William Scott said, "The only way to predict if the cloud in your horizon is due to glaucoma is to get tested. No matter the diagnosis, it is a clear forecast for your vision in years ahead." It is the World Glaucoma Week. Today, we'll be talking on glaucoma. I am Ayeni Nicole. Stay with us. We'll be right back. Welcome back. We have a guest today here with us, Dr. Mrs. Bukola Ayeni, a senior registrar in ophthalmology, working at Olabisi Onabanjo University Teaching Hospital, Shagam. Welcome, ma'am.
Thank you very much.
Yes, ma'am. So we're talking about glaucoma. How would you describe glaucoma?
Glaucoma is a blinding eye disease and it causes irreversible blindness. That means once the vision is lost, there's nothing anybody can do about it. And in the midst of 20 people, we have at least one person from age 40 and above that have glaucoma. And out of the people that have glaucoma, about 19 of them don't even know, they are not aware that they have glaucoma. And by the time they will diagnose it in 5 people, one person already have a blind eye.
Okay. So how then would you know you have glaucoma, or what are the symptoms that you know that, okay, I probably have glaucoma?
Well, glaucoma usually does not give symptoms in most people. It is until the vision is lost or almost lost that they know. Because what glaucoma does is to destroy what we call the peripheral vision. So the vision on the sides. So the patient still thinks, because I can see straight ahead, that he can still see. So most people don't know until it gets to the critical level. And because the nerve of vision, the optic nerve, has more than 1 million fibers, and it is until about 80 to 90% of it is destroyed before it begins to give signs and symptoms of blurry vision. The patient will see that he's not seeing well, or by the time the peripheral vision is destroyed, the patient begins to bump into people or objects because he cannot see the side. It's only what is ahead that he can see. So that is what happens. But at that time, it's already getting late.
Okay, so I've heard saying that glaucoma is a silent thief of sight. Is this why?
Yes, because it takes about 90% of the nerve to have been damaged before the patient knows. So it has been destroying the vision, and the patient is unaware. So that's why it is the silent thief of sight.
Okay. So you mentioned 40 above. Can you tell us the age group in which people are mainly affected by glaucoma?
Yes, like I mentioned, from age 40 and above, people are more prone to developing glaucoma. But glaucoma actually can affect any age group. The young adults, even babies, the newborn, they can have glaucoma. So that's a good when it is congenital in nature. Okay. So there's nobody that is spared. So that's why everyone must check their eyes.
Yeah. So the best way to know you have glaucoma is to
go
get
for
tested.
an eye check. Yes.
Yes. So the pressure that happen in the ocular space in the eyes, it's probably what causes glaucoma.
Yes. Cause glaucoma is usually because the pressure in the eye is much. The intraocular fluid, what we call the aqueous, there's increased secretion. That's a path by which the glaucoma can happen. So because of the increased pressure, because of the increased secretion, the nerve is destroyed. And some of the times it is because the outflow tract, because when there's regular turnover of the aqueous, the fluid in the eye, because some paths are blocked some of the times, so the fluid does not have ways to go out of the eye, so it further increases the pressure, and so all that causes destruction of the optic nerve fibers. So that's what happens majorly. But at the same time, some people, because they have trauma, maybe a blunt injury, something hits them in the eye, somebody give them a blow in the eye and things like that, it can destroy some of the structures of the pathway, and then it causes increase in intraocular pressure and further destroys the nerve.
So back in my secondary school days, there was this girl we called Cat Eye, and then I just needed to ask her that what happened to you? Why is why is there a white stuff in your eyes? And she told me that it happened when she was younger and it was glaucoma. And some people say it's probably cataract. How do we know the difference between glaucoma and cataract?
For glaucoma, like we have already established, it is the destruction of the optic nerve, the nerve of vision. But for cataract, it is because the lens becomes opaque, it becomes whitish, and usually occurs as people age. Just like we used to have gray hair when we grow old, the lens in the eye also becomes opaque and white. It usually occurs in the elderly. So if somebody lives long enough, the person will have cataract. And that can also happen if someone has trauma to the eye. The person can develop cataract. So it's different from glaucoma in the sense that people have glaucoma without having cataract, although some people have both. So when you see a whitish thing inside the eye, it's probably a cataract. But the schoolmates of yours that you mentioned, if a young child, I mentioned that babies can have glaucoma when they are just born, as newborn. So if it is not picked early, the cornea becomes, that's the clear part of the eye, it becomes cloudy and becomes white if it is not picked on time and is not attended to on time. So such a person can have a corneal opacity due to the complication of the congenital cataract. So that probably may be what has happened to the person. So for newborns, they can, I want to talk about the symptoms that we can see in newborns. When new babies when they are born and they are becoming too sensitive to light, they can't open their eyes, frequent watering, or you see that the eye is abnormally large compared to compared to other children, then take note, that child may be having a congenital glaucoma. But for adults, usually no symptoms until it becomes problems. It's too late. And then also, we also have the kind that may give symptoms. That's when they have angle closure. That one is like an acute angle closure glaucoma. That time, the eye becomes painful, watery, the person can even be vomiting and all that. That's when there is an acute angle closure in that particular person. But generally, glaucoma does not give signs or symptoms, so to speak. That's what the patient complains of. It doesn't, unless it becomes advanced.
Okay, so now that you are probably gotten glaucoma and you've tested and you've confirmed that this patient has glaucoma, how can you treat glaucoma?
Glaucoma can be treated in mainly using medications. It can be by surgery. We can use laser treatment. But all this depends on your examination findings when you are seen by an ophthalmologist, and will assess the best way to treat. So we have drugs that we give them. Some people will do well on drugs. Some people may need surgery to reduce the pressure, and some people will need both. Some people will also need laser. So those are the methods by which it can be treated.
Glaucoma be completely cured?
No, glaucoma cannot be completely cured, at least for now. Although some other investigations are going on, we are hopeful for a bright future that we will find a cure for glaucoma.
Okay, is there any other thing you'd like to share with our audience?
We are celebrating the World Glaucoma Week. It is to create awareness of glaucoma for people. So people are advised right from the age of 30, 35 and above, people should go and get their eyes checked up. A dilated eye examination with an ophthalmologist, your eye doctor. Go to the hospital. You may not have symptoms, you may not have anything, just go there that you want to check your eye for glaucoma, because that's the best way to prevent it, so that when it's picked early, it can be handled early and the chances of vision loss is reduced, especially if there is a family history of glaucoma. But you know, in our setting we have poor family tree. Many people don't know what has happened to their forefathers and things like that. So it will be beneficial for people to go to the ophthalmologist, check your eye, even if there is no symptom, yearly, if you don't have any family history. And if you go and there's nothing, just yearly. But if they discover something, every 6 months, and then whatever, it depends on what they find, they will advise you the best way.
Thank you for joining us today, and thank you for educating us. If you liked this episode, you could visit our social media handles to see more episodes on Twitter, Instagram, Facebook, or YouTube at Official Remo TV. You can visit our website too at www.remotv.com.ng. Stay healthy.